Hi, this is Diane, and welcome to DMD Digest. Today we're going to talk about something called gastroparesis. Sounds pretty bad, and it's not really a good thing to have. But in lieu of talking about digestion problems, which is what we're here to discuss, and all the different things I've talked about thus far, different things that can create stomach and intestinal distress, I wanted to mention gastroparesis. And what that is actually is when there is a problem in your stomach and how it's emptying. And what happens due to a lot of different causes that I'm going to discuss in just a few minutes is basically the food in your stomach is the digestion process is slowed down, so it takes a lot longer for the food to empty into your small intestine. And what happens with that would be a lot of gas, bloating. There can be some significant abdominal pain. Often people have nausea and actually have vomiting with this as well. And it obviously can lead to a lot of absorption problems. And something that is a term is that can develop is called a basor. And that just means that the food can actually kind of accumulate into like a solid mass and can actually cause some obstruction in some circumstances. So this can be a dangerous situation. It's a chronic condition. It is not something that can generally be fixed, although there are a lot of different procedures that can be used to help matters. So what we're going to be talking about today is also some causes. How do we manage this? What are some tests that can be done to assess to see whether or not you might have that? Some things that can cause this are, for one, diabetes. Diabetes type 1 and type 2 do make you a lot more prone to developing gastroparesis. And a lot of that has to do with just the sugar content, how your pancreas is releasing insulin. Just the whole digestive process can be interfered with. Thyroid disorders, Parkinson's disease can also lead to this. Restrictive eating or dieting or significant like long-term intermittent fasting, eating disorders such as anorexia, bulimia, binge eating disorders. There are a lot of other causes as well. There's some thought that even like excessive fatigue, also known as chronic fatigue syndrome, might also cause some of these things. I mentioned metabolic disorders, thyroid disorders, some illnesses like a viral gastroenteritis as well, and that would be more of a temporary thing. But probably one of the more prominent things would be diabetes. I generally, or some of the research that I've done as well, that can be a very common situation. The concern of that obviously is blood sugars can drop significantly. You're not digesting, your food isn't being absorbed. You take the insulin again significantly drops your blood sugar, and it kind of leads to this crisis state. Another thing that I forgot to mention, which is also a cause, is pain medication. Many of us, you get injured, you break something, you have surgery, you're on pain medication. I'm not necessarily talking about that because that's generally just prescribed for a short period of time. But people who are on long-term pain medication, or at least are taking it daily every few days, but it's for months and months or maybe even years. So the use of narcotic pain medication, not ibuprofen or Tylenol, even though I have done some presentations in the past where talking about ibuprofen and naproxen, such as Aleve, can interfere with your intestines and absorption and things of that nature. This would be more narcotics like Vicodin, Percocets, oxycodone, morphines, tramadol, things of those natures that are known to slow your digestion, slow all those processes, are very dehydrating and can also lead to constipation, can also cause gastroparesis. So let's talk about some different testing that can be done. And as I am going to mention, this isn't conclusive, but there's a lot of different things that you can do that when you present to your doctor or advanced practice provider, you can discuss these. One of them is a gastric emptying test. There is something called an EGD, which is an esophageal, duodenal test they do where there's a tube with a little camera on it. They can kind of look around in there. There is a gastric breath test, which measures carbon dioxide from your breath. There is the barium swallow. Some people have heard of that. There's blood work that can be done. There's radiological type testing that can be done. There's like a wireless, like a capsule that you can swallow, which kind of passes through your GI tract, that can be monitored and assessed to look at how your stomach is emptying and the rate and how well. So what do? There are some things. As I mentioned earlier, this can be chronic. This is something that you can't cure, so to speak, even though, as I said, there are some surgeries. Sometimes people that are severely afflicted end up needing IV nutrition or a tube put into their small intestine for feeding. There can be some other surgeries that they do to try to bypass the stomach or improve the rate of absorption and digestion. But other measures that you can take, because those are all pretty severe, those are all pretty scary. Couple of different things. For one, there's a pretty lengthy list that I'm going to go through of foods that you need to be really cautious of, and some to avoid, some that are okay, that we'll go through. One thing is to make sure that you're very, very hydrated. Drinking enough fluid, predominantly water, helps to not only promote the digestion, make it a little bit easier, make it a little less likely that you're going to develop that hard mass in your stomach that I mentioned. But we're talking about like 6-10 cups of fluid a day. Another thing that you can do is some people find it really helpful to make their foods as soft and pliable, if you will, as possible. You can puree foods. You can mix some foods, especially like meats, in a blender and use a broth and puree them so it's a lot easier to digest, and a lot of that work has already been done in the blender or food processor. Other things are making sure you really, really, really chew your food slowly, and make sure that you eat small amounts but a lot more frequently. Doesn't mean that you have to have a meal and have 5 or 6 meals, but even just really small amounts of something, and maybe 5 or 6 times a day, really helps to be able to digest a little bit better and not have the huge quantity hit your stomach all at one time. Some foods to consider, the okay and the avoid list. For one, dairy. Be cautious with dairy. You can fat-free, skim, those kind of dairy products are much better tolerated, but be really cautious with whole milk, half and half, creamers, cream cheese, cottage cheese, sour cream, those kind of things. I would eat very small amounts or avoid completely. I know fiber. Everyone talks about in every diet you ever hear about, whether it's a diet to lose weight, a diet for your intestinal health, for probiotic use for everything known to man is always eat, high fiber foods, lots of grains, lots of fruits and vegetables, things like that. If you're suffering with gastroparesis, you do not want to do that. Actually, high fiber foods are very difficult to digest. You definitely would want to avoid, as far as fruits go, any fruit that has a skin on it, including blueberries. Actually, kind of any berry with seeds. As I said, anything that you have, like apples, anything that has a skin that is harder to digest. You can cut it up really small. You can eat little small bits and pieces of it, but you also probably want to experiment first and have a few bites, see how you do with it. As I mentioned, other high fiber foods such as vegetables. Raw vegetables are kind of off the list, not a good idea at all. If you want to try vegetables, then try to really cook them, steam them, make sure they're kind of mushy. The exact opposite is what a chef would tell you. You can also, if you need to puree them, that's fine. Sometimes canned vegetables, even though they're higher in salt, they're not the best for you, but it's a lot softer, a lot easier to break down and digest. Fatty foods, a definite no-no. You do not want to eat greasy, breaded, fried foods at all. If you do, it's got to be really small amounts. Those are really super difficult to digest. Soups, once again, if you're going to use soups, make sure they're like broth-based soups, not cream-based soups. If you do use a cream, use a non-fat or skim milk. As far as like lactose-free, that doesn't really matter because we're not talking about lactose and milk sugars. We're talking about just the digestion of the fat. Nuts. Once again, we hear a lot of hype about nuts in general. Great, but if you have gastroparesis, not so smart. They, once again, a lot harder to digest. This kind of includes all nuts. Now, if you do a nut butter, such as peanut, almond, cashew, any of those nut butters, once again, just make sure that it's not like the chunky kind that already has pieces of the nut in it. Meats, you want to try to avoid processed meats, high fatty meats, bacon, sausage. Be cautious with beef. Your chicken, fish, the turkey, things like that are going to be easier to digest. Lunch meats are bad news. Anything that's been super processed, really high in salt and fat content is much, much harder to digest. Unfortunately, that includes like pepperoni on pizza, things like that. Very difficult to digest. Getting down to the bottom of the list here, beans, legumes, however you want to refer to them. Beans also really difficult to digest. I guess if you were like refried beans, maybe not so bad. Or once again, if you like mush them up really well, maybe add some broth or something, that might be a little bit easier. Alcohol. Alcohol is not a good idea either. Once again, all these things that I'm mentioning that, try to avoid. If you can't avoid them, and I know, holidays are approaching and just times that you just want to be able to have something, and I totally understand where you just want to be able to have that food that is probably going to upset your stomach, but try to have little bits and pieces of it. And I know it's so difficult, but you're going to feel better in the long run. So those are pretty much the foods to consider, what to avoid. We talked about some causes, how to be cautious. We don't want this to end up as a surgical procedure, or your nutrition is coming from a tube in your stomach, or IV feedings, anything like that. Certainly, I think if you do your research, you keep a food journal, get an idea of what you can tolerate, what you can't. Using the small amounts, just kind of spaced throughout the day, I think will really help you. But this is pretty significant. And people who struggle with this is a lifelong behavioral modification thing that you have to do. And along that line, one of the things I did mean to throw in there is, especially with dieting, weight reduction, things like that, we're so hyper-focused on that. People who have had bariatric surgery to lose weight are at a very high risk of developing gastroparesis. So these are all things that I'm hoping will be very helpful to you. You'll find beneficial. You'll be able to incorporate into your lifestyle and make some changes for the better, and maybe get some information that can help you feel better and have a higher quality to your life. So thank you very much for listening and paying attention to this, and I will see you back soon. Thanks again.